Hello, my name is Chris Johnson, and this is a presentation on selective mutism. Over the course of the semester, I have been studying selective mutism, and this presentation will include a background on selective mutism. I'm going to discuss a couple of interventions that I found in the research, and finally cap off with giving my thoughts on future implications for research as well as gaps in knowledge. With that being said, I'm going to start with what is selective mutism. So, selective mutism is an anxiety disorder primarily diagnosed in children, characterized by consistent failure to speak in specific social situations where there is expectation for speaking despite speaking in other settings. So what this would look like in a school and home setting where you'll primarily see this with children is that child is non-communicative around their peers, teachers, and other administrative in school, but when they're at home in a safe environment, in a familiar area around familiar people, they are able to speak with no delays, pretty much speaking normally. So that non-communication is not due to a lack of knowledge or physical inability to speak, but it's more so due to severe form of social anxiety where the fear of speaking causes a child to become mute in certain environments. There's an increased evidence surrounding the fact that children with selective mutism display high levels of shyness, become more easily distressed when facing novelty in certain situations, and they tend to withdraw from unfamiliar situations as well. The prevalence of selective mutism is a rarely diagnosed disorder. And the onset of selective mutism is around the age of 5. Research also indicates that it may not be noticeable until the child enters school. So again, that child is entering school around pre-K, so kind of in that age set between like 2 and 5 years of age is where you would see the diagnosis. And research also indicates that it affects approximately 0.03 to 2% of children, where you will see girls diagnosed more than boys with a ratio of 1 to 2. Selective mutism does not fulfill the diagnostic criteria by the time a child reaches the adolescent stage or adult stage of life. So meaning that selective mutism kind of goes away as the child progresses and develops through life, where they'll eventually be able to speak without fear or distress in specific situations as time goes on. So how this impacts families and children and the community, where you will see parents and especially teachers not having a clear understanding of what selective mutism is. And what that does is it leads to, I guess, kind of like a stigma around those children, where those children that are not speaking because they have fear of speaking are seen as oppositional in school and also developmentally delayed, where in this case in point, it's more so the child is displaying a fear of not speaking. So there's just a lack of education surrounding selective mutism in the community and amongst family members. So now I'm going to discuss a couple goals surrounding selective mutism. Sorry, it's not a couple goals, 2 interventions about selective mutism. One of those interventions I'm going to discuss is school-based interventions, and other ones is exposure therapy. Starting with the first, school-based interventions are interventions that create an environment where the children with selective mutism can feel safe, supported, and gradually empowered to communicate, which will lay down the foundation for both academic success and personal growth. School-based interventions are critical components of treatment for selective mutism, because children with selective mutism often function and speak normally at home, but in a school setting, they primarily affected with their learning, socialization, and emotional well-being, seeing impairments in those categories. So these children could use these strategies from these interventions to help support a safe environment, reduce anxiety, encourage communication, and support academic and social development. So some of the goals of school-based intervention are reduce pressure and anxiety around speaking, encouraging the student to gradually communicate in a supportive way in school, and other specific settings, promoting participation in classroom activities, and educating staff and peers to foster understanding and inclusion. So one of the commonly known school-based interventions are psychoeducation, where teachers, counselors, and school administrators are trained on given understanding of what selective mutism is and what it isn't. Educators are also able to learn to avoid pressuring the child to speak, which can increase anxiety. And another thing I wanted to touch base on is schools collaborating with mental health professionals, where that would look like, what that would look like is the teachers or the school having a mental health counselor or psychiatrist inside the school itself, where the student can meet with that mental health professional, or the teacher or the school collaborating with mental health professionals outside the school to make sure that the student is getting all the needed support to academically succeed in school, and also encourage them and empower them to become more comfortable and safe in communicating amongst their peers. So the next one I would like to discuss is exposure therapy. Exposure therapy is a psychological treatment designed to help individuals confront and reduce their fear and anxiety responses. And it's mostly commonly used to treat anxiety disorders, including like phobias. It helps with PTSD, OCD, and selective mutism. And the relation to selective mutism, for the purpose of this presentation, what that would look like would be the therapist or the professional working with that student would begin with nonverbal communication in a safe setting, then eventually progress to whispering or speaking to a trusted adult, and then eventually the student would begin to talk in larger or less familiar situations over time. So it's more a gradual steps through exposing the child to different situations to hopefully empower them to speak in specific situations. So the core principle of exposure therapy is based on the idea that avoidance of fear situations reinforces anxiety over time, but gradually, again, repeatedly exposing a person to the source of the fear in a safe, controlled environment, their anxiety can be decreased, which in turn will help that child learn that the feared outcome is unlikely or not as dangerous as they intended it. So what I will end with is just what I feel are some of the gaps in the knowledge around selective mutism, where what I've commonly seen is just a lack of understanding of what selective mutism is. And I think the gap in the knowledge, most importantly, is caused by limited amount of literature and research surrounding selective mutism. And this is due to the rarity of the disorder. So because the disorder is so rare, there's not a lot of literature surrounding what is effective as far as interventions. And from the research that from the studies that I read, a lot of the limitations that the researchers ran into was due to small sample sizes of children with selective mutism, because it is, again, a rare diagnosis. So not really seen on that front. But what I really feel like what would help is exploring more of these interventions, especially the alternative ones, to see which are more effective, and then come up with a plan that we could provide these the students with a more concrete plan to address the selective mutism and the symptoms surrounding it, as well as providing teachers in school with the education surrounding selective mutism, as well as parents and family members. So everyone is educated and working together, integrating all compasses of treatment to ensure that the child receives the best quality care in life, and as well as education, so that they are professionally growing and becoming academically successful. Thank you for your time.